Everyone. Good morning and welcome you all today for this event. And we are really uh, happy to have you all here. So, as Neil mentioned, we are currently focusing on a project on sharing information for physicians and nurses in order to be able to pursue their healthcare related career here in Canada. So as part of that, I will be sharing some information regarding the pathways to pursue here in Canada for physicians. Please let me know if you're able to see my slide moving. Can you see the next slide?
Yes, Saida.
Thank you very much. So for physicians here in Canada who have graduated their medical school and their training from outside the country, there are a few pathways that you could proceed. One is licensing through matching credentials. If you are from some of the approved jurisdictions, approved jurisdictions in the sense countries like Australia or UK have their credentials equated to the ones that you get from Canada. And apart from that, you could also pursue another pathway that is licensing through uh, practice ready assessments, where you could clear a series of exams and work under the supervision of another physician for a brief period of time, and then you can get your license here. And another pathway is pursuing your licensing through residency, which is post-graduation. I will be discussing in detail about these two. And also another way is to pursue through an alternative or lateral healthcare professions that does not always require licensing, but some do. I'll be mainly discussing about the pathway that most international medical graduates go through, that is either through residency or through the practice ready assessment that I mentioned earlier. So in order to do that, the first step will be to verify if our medical degree is from one of the institutions mentioned in the World Directory Services. That is, if you have a valid medical degree. And once we are able to check that, we'll have to open an account in physiciansapply.ca, and we'll have to follow a series of steps that that particular website recommends us to do. The first and most important thing will be to do the source verification, which is basically verifying your credentials that you have gotten from the universities back home or through the medical council here in Canada. So that is source verification. I'll touch briefly regarding that, and then we'll go through some exams. The two most common and most important ones are the MCCQE1 and the NAC OSCE exam. So this is a theory-based exam, and this is a clinical exam. And there will be some additional exams that can also be required by certain programs or by certain provinces. And once we're able to do that, we can get the licentiate of medical certificate here in Canada. It's more of a procedure that once you're able to get all the certificates and training done, you get this licentiate. Once you get the licentiate, you become eligible to either apply for the post-graduation through CARMS. CARMS is Canadian Resident Matching Services, or the NAC Practice Ready Assessment, which is basically you can start working under the supervision of a physician, and then you can start working on your own to get by having your own license. So just a quick information on the source verification process. These are the most commonly required documents for you to be able to process them. And the cost can change every year, but this will be the approximate amount that can be required. And you only need to submit the copies. Originals are not required for this. And the next step will be, as I mentioned, to go for the qualifying exam, this is the theory-based exam. So this happens in 4 different sessions in a year for a period of 4 months. And before we had two parts to this exam, QU1 and QU2, but after the pandemic, they have called off QU2 for the time being. So QU1 will be enough. And this is the NAC OSCE, which is the clinical exam. Um, this is in person, and you can choose an exam center and complete the payment, and then you can perform the exam. So I will quickly go through some exam preparatory resources that we thought were really useful for many of the participants. Mostly for the QU1, it's more of a self-study process. So these are some of the resources that can be used. Most people use Toronto Notes, like it's the preferred and recommended textbook. But apart from that, people also find it useful to use Kaplan USMLE books. And there is a book called Essentials for the Clinical Medical Licensing Exam. And Doing Right can be used mainly for ethical aspects of the questions. And there are some preparatory tests available directly from the MCC website itself. These are quite pricey, but the questions are very similar to the ones that you see in the QE1 exam. And for Q banks, UWorld is definitely has a lot of content and information. However, the question pattern cannot be as similar as the ones that you can see in this website. But to learn and to be able to practice more and more questions, UWorld is definitely a good place. Canada Q Bank also has a lot of questions, but if you are going through UWorld, then you wouldn't have to pay extra for this. Um, and for the websites, most of the questions that are from these MCCQU1 are based on resources from UpToDate. But again, it's a very pricey website. There are other alternatives that you can look into, for example, AAFP, clinical recommendations. And also for ethics-based questions, CMPA good practice guidelines are really good. They also have some practice questions that you can try. And other online resources, or Lecturio and online MedEd, these are the things that where, some professors will be able to come and explain the topic. And there are a lot of Facebook groups and other forums that are available online that you can help yourself connect with the other people who are preparing, especially in your region, so that you'll be able to communicate with each other and exchange resources. Um, so this will be the overall cost for completing the exam. I thought this would be useful, even though you have some exam fee, but also people spend a lot of money on exam preparation, be it buying a Q bank or going in person to classes. And and then also for NACOSCI, which is the clinical exam. And so these are some of the resources that can be used for NACOSCI. Again, for a website, there is a particular web page called MCC Objectives, which is mainly seen in the MCC website. So they go through all the topics that are important for a medical expert to be familiar with. And most of the exam topics for the NACOSCI will be based on these on these topics. And also for the textbooks, Edmonton Manual, they give a very nice outline for each and every topic. For example, ascites, like they give a nice outline of how to take a history, what are the most important points until diagnosis and treatment. So they give an overall picture of for each case. You could also try for first aid for the USMLE Step 2 CS. And some people also choose to follow therapeutic choices to be able to familiarize themselves more with the drugs and the treatment choices here. I'll briefly go through the CARMS residency, which is the post-graduation process here. We do have around 40 programs with among 17 medical schools. There are two streams, which is the Canadian Medical Graduate Stream and the IMG stream. And most of that and IMGs will be going through this stream. So they go parallel to each other. They don't compete with each other, except for in Quebec. And also there are two iterations. That is the first iteration, which is where most people apply to. Um, this is where the CMG and IMG streams are, I mean, they go parallel to each other, as I mentioned, except in Quebec. But once the match process is over either in February or March, people who have not been able to match in the first iteration also choose to go for another similar pathway. That is the second iteration. So the positions that when unmatched will be available for the second iteration. However, in the second iteration, both CMGs and IMGs are in the same stream. So that will be more competitive again. And some of the basic eligibility criteria are that you have to be a graduate from a valid medical school, should either be a Canadian citizen or PR, and there are some exemptions if you have some refugee status as well. And exams are QE1 and NAC, except for a few provinces where they also accept USMLE exams. And some of the common additional exams is that IELTS or any proof of language proficiency. OET medicine is also being increasingly accepted by most provinces and programs. Another one is CASPER. This is more of a behavior-oriented exam, like how you're able to manage situations. And this is one of the common exam expected in some of the provinces. And since family medicine is one of the most common program that IMGs opt for, there is another exam called FM Pro C, which is required in these provinces if you're choosing a family medicine program here. So I'll briefly go through how to participate. Like you have to open an account, pay the fees. You can apply for 9 programs with the first fee, but for each additional program that you'll have to pay extra around $31 as of now, but this can be subjected to change. And then sign your comms contract, and almost all IMGs will have to sign a return of service contract. So for the same number of years you're doing your residency, you will have to return your service in a place other than certain areas, like for example GTA or in the main Ottawa area. So apart from that, you'll have to return your service in a rural region. But for family medicine, even though it's only 2 years of residency, you do have to return your service for 5 years. But this particular contract is not seen in Quebec or in Alberta. There are 5 phases of the match process. That is, phase 1 is basically the application period. You'll just have to follow all the steps, upload all the documents, and ensure that you have completed all the necessary steps. And these are some of the documents that you will be required to upload. And there will also be some additional documents based on the province or for the programs. Even for your personal letters or for your statement of purpose, it can be different based on the program or the school that you're applying to. And this is phase 2, which is the file review program. That is when you will have the interview as well. That is when you'll have to prepare for your interview. And in phase 3 is the interview period. So you would have received an invitation for interview, and you'll have to keep following that. And phase 4 is that once you have completed the interview, you will have an idea of how you have been able to perform in the interview and what kind of programs that you wanted to choose. So based on that, you'll have to rank them. So there will be a rank separately. You will be ranking the programs based on your preferences, and the programs will be ranking the candidates based on the performances. So if there is a match, then you'll get matched. So it depends. It is based on an algorithm. So there are many videos available on the CARMS website to see how the algorithm works and how you can increase your chance of being able to get matched. There are a number of 3 main factors. One is about the number of available positions and how the programs have preferred the applicants and how the applicants have preferred the programs. And this is the match day. And so following that, like I mentioned, you can go for the second iteration if you don't get matched, and there are some positions that you think that you can apply to. And most of them are competitive streams in this period. So the other option, so one is the post-graduation option, which is through residency. The other one is practice ready assessment. So where you can finish a series of exams depending on the province and work under the supervision of a physician in that province, and the period can differ based on the province that you're selecting. And once that is over, you can get your license to start practicing. So currently we have 8 provinces that offer this service. Like there were only 7, and Ontario was, I mean, the practice ready assessment in Ontario started only this year in June, June 23rd. So this is also another option that people can opt for. So for this, you should have, based on the province, there are some requirements. For example, some provinces would require for at least 24 months of postgraduate training to be able to eligible for practice ready assessment. And there is also an expectation of recency of practice. If you, I mean, you should have been able to practice for at least 6 months or 3 months, again, depending on the province, before applying for practice reassessment. And there are some also additional exams to go for. And these are some of the alternative pathways to choose, or you can also call it as a lateral pathway that you can choose while you are trying to pursue your licensing. There are some bridging programs that are available. I'll go through briefly some of the programs, but in the following presentations, you will also be able to get more information on that. And some people choose to do master's or PhD and also get some license get a license in an alternative profession. For example, these are some of the bridging programs that you can opt for. So this is currently an ITP program being offered in University of Toronto, and you can also have a look at all these programs as well. And so these are some of the other licensed options that I mentioned. For example, I mean, both licensed and non-licensed. For example, midwifery program, you'll have to go through, a training, and then you have to go some examination and get a license sought, and also like social worker and in radiological technician or a clinical research program that are being offered in a number of colleges like Seneca, where you can do a course for 1 year and then you get qualified for clinical research here in Canada. And some of the most common masters people pursue is Master of Science in Global Health, or in other Master of Sciences based on their previous experiences, for example, pathology, immunology, and all that. And Master of Public Health, Master of Health Informatics, Sleep Language Pathology, and also Physician Assistant. Most of them are quite competitive, but still it is a good lateral pathway to pursue. So I'll also briefly go through the project that we are doing in Pegasus, where we are focusing on providing all these information in a website and offer mentorship services. So we are on the works of creating a website where we are able to gather all these information in an interactive way and as user-friendly as possible. Like Neil mentioned, we are currently adding information for physicians and nurses, but we are planning to add more. And you can also go through a questionnaire which will help you guide through the number of options that you can choose from, or options you will have in order to be able to pursue your healthcare career here in Canada. So, I had to rush through a few of the slides in the interest of time, but please feel free to ask any questions if you have. I'll be happy to answer to the best of my ability, and also welcome everyone here to participate.
Okay. Thank you, Saida.